Good morning. So I'm Andy Sanford from We Are Lean and Agile. I'm the Director of Improvement, and I'm really lucky today to have Jacob here with me, and we're going to have a bit of a chat about health and social care process mapping and processes. But Jacob, do you want to start by just telling us who you are?
Yeah, so I'm Jacob Chowdhury-Ball. At the time of this work, at least I was senior business analyst in our central change management team. Has since changed, but that's who I was, at least when we did this work.
Yeah, and so congratulations on the new role.
Thank you.
Believe starting exactly today. So
Okay.
What's the new role?
It's performance and insight manager within our central performance team.
So yeah, Cardiff City Council.
Yeah.
So brilliant. Obviously, we're starting more and more to work with, most of our customers work with social care processes, sometimes the NHS as well. And obviously, I knew that you had worked with social care processes from, back along 2-3 years ago when I first trained you, because I still sort of reference with various people what you can do in the free trial, and how I actually thought at the time, wow, kudos to Jacob. That is, with 1.5 hours training, not the full day's training, you went and you did social care processes. And I think you did about 20, didn't you, before you had the training?
Also in the hour and a half, there was a lot of trial and error involved in learning how to use it in the early days.
Yeah.
But, it was around 20 odd processes I think we mapped in the end.
Well, it can be quite scary when you are that early with Engage, because Engage is really, really easy to use, but that's only when you know how to use it. So the 1.5 hours kind of gets you going. And I normally say to people for that trial, just map some processes you've already mapped. Don't stand at the front in front of people, because if you get stuck, it can be a lonely place going, I know this is easy, but so yeah, do you want to do you want to tell us a little bit about some of those processes and what happened and what you found really?
Yeah, so the contact was once we started to bring Engage in, and we were sort of trialing and demoing it within the team, we were already sort of a couple of weeks into what we called a service review. So it was essentially a targeted, so 12-week process where a business analyst is sent in, or sometimes a small team of business analysts, to look at a specific problem that's been highlighted by either cabinet or senior management. So this one in particular, we were looking at social care payment processes. So from things like petty cash to food vouchers, payments for foster carers, that sort of stuff. So when Engage came in, we'd already had some of this stuff mapped in Visio, which as part of this we converted to Engage as sort of the trial run. Then the newer ones we were mapping in Engage from the get-go, because of our reporting and the people had seen the Visio processes already. We were still doubling up, so we had everything in Visio and everything in Engage. Visio mainly was for show and what we would include in the reports and the comms stuff that went out, but Engage then was where all the analysis happened essentially. So that's where we used all the metadata. In terms of what the actual approach was, so using Engage, we would have, back then when we were allowed to, we would have workshops in person. We'd have Engage up on a big screen, and we'd usually do it in pairs. So you'd have somebody on the laptop controlling the screen, running through Engage, typing everything up as they went, moving the boxes around as we needed to, occasionally chiming in with the questions. And then you'd have somebody else then who would be facilitating, leading, so guiding it through. They can be more engaged in the conversation because they haven't got to take any notes, they haven't got to write anything down. They can just be part of the session essentially, whilst the other person then does everything on the screen. It worked really well. What we were trying to capture as well, so depending on the complexity of the process, some of them we did in 2 runs. So we would do the first run, and this is for the as is, I should say. We did the first run just to get the process out and go into a fair level of detail. And then the second run would be to add in the metadata and to validate the process. So, whatever is produced from that initial workshop, usually we would have to do a bit of tidying, post session, and then come back to that then with the same group again in maybe a week or two's time. I don't know if we did this for the earlier ones, but obviously as we learned more about how Engage works, we would share that link as well.
Yeah.
So in between those two sessions, people could then add their own comments on the diagram. So we would use that time to tidy up, take any feedback on board, go back to them with sort of a version 2 of the as is, confirm that process, and then also add in the metadata as well. So taking in grades of the officers who were completing the roles and how long each one took.
Yeah. That's cool. I was actually just going to ask that question because you mentioned metadata. So for those that don't know Engage, what kind of extra data are you putting on the map?
Yeah, so it was mainly so the time that each task took, and then assigning each task a role. For some of them, we did assign systems as well. So the biggest sort of efficiency we found, and the biggest sort of problem with the current process really was use of Excel spreadsheets. So in Cardiff, we've got Care First as our core social care database, and we've got SAP, which is our financial system. But parallel to both of those, there's a series of spreadsheets that the different teams involved in the processes would keep. That often duplicates information held in the systems, or sometimes, the important stuff is on the spreadsheet, maybe not necessarily.
Absolutely, yeah, because sometimes these systems don't provide the function. So what do? You have to create a manual workaround, but obviously there's risk in that and there's time in that.
Yeah. So yes, that was one thing we found. So for some steps, we would add on the system. So it would be, right, well, this step takes place in SAP, or takes place in Care First, or this step takes place in an Excel sheet. Then we would name the sheets. We had in the background, just as an Excel list, then we had ironically the list of Excel sheets they were using. So we knew in addition to our core systems what other sort of systems are in use, essentially, even if they're just spreadsheets. So that's the metadata we used. At the time, we didn't have, which I now know is new from our last catch up, the ability to add that multiplier.
Yes, yeah.
At the time, there was still a little bit of manual calculation outside of Engage as well, just to multiply essentially the process instance by the volumes. So if we were working to 1 year, for example, we'd say, okay, well, how many of these payments do you process in a month, and then times that up, and then get the whole cost of the process for a year, essentially.
Yeah. So it's worth clarifying again for people that don't understand, because obviously we've been in the system a little while, but Engage by default will calculate the cost and the time relating to one of them. At the time, there wasn't this additional function, but because of user feedback, this function came in that enabled people to put that multiplier. Because what I found before was most people want to look at the annualized amount, not really for one. Okay, for one, it's fine when you compare in like with like, but at some point, someone wants to know, so what annually? And it's normally annually, isn't it? Because we budget annually and all of that sort of stuff. So yeah, just to clarify that point, but go on. So carry on. It sounds like you would have painted quite a compelling picture at that point, because I can already see in my head spreadsheets dotted around. It's waste, it's rework, it's that kind of stuff.
Yeah, we could use so even just aside from the total process time and process costs and stuff, we did use Engage as well to tally up the number of steps that use the system, so we could see, okay, well, I don't know, only 3 steps use this system, and then you've got, I don't know, 10 steps using different Excel sheets, for example.
Yeah.
So that stuff was useful as well, even not the sort of big hitter cost and time stuff, just understanding the breakdown of steps and what to use at each stage was useful as well. But yes, that was to get the as is. Similar sort of approach then really for the 2B. So we did it in 2 runs. We get people in, we map out the 2B, do the feedback, bring everyone back again to fill in the metadata. Obviously, there's some estimation involved with the task times for the 2B. And we usually go on the stakeholders' instinct there, really. They're the ones operationally doing these processes, so we take it from them. There was some where it was a case of, this takes this long in the future, I don't know, let's just cut it by 20%. So some of it was sort of ballpark, some of it was a little more firm in terms of sort of predicting how long it would take in the future.
sorry, I don't know whether you mentioned this. What was because obviously the work you were doing was to go and tackle some problems. So what were the presenting problems, the visible problems that were the driver? What were you trying to improve? Before you just tell us about what you found, I was just in my head thinking, oh, we haven't talked about we've talked about purpose, but yeah, was it speeding up payments? Was it errors
Yes,
or
that's part of it. Yeah. So I think it was acknowledged as being that the process was a bit dated. You know, that some of these processes hadn't changed for several years. It was acknowledged that there were various spreadsheets in use as well, which was seen as maybe a problem. You know, something to investigate, I suppose. Speed of payments was one thing. Accuracy of payments. I believe there was some feedback from foster carers about the process as well, which prompted the work. I do have some notes on the drivers to change actually. So
no, that's pretty good, mate. Speed, accuracy, bad customer feedback, and obviously with foster carers. So I've done quite a bit of this social care work, and with foster carers, it is really important that you keep them happy. There is a massive shortage.
Bring them in, exactly.
Yeah, and if you have to buy private rather than having your own, the cost is ramped right up. So that in itself, cost avoidance is a really big driver in that area. I'm not saying specifically in Cardiff, it's just a national problem with that. So yeah, go on. That's brilliant, mate. What did you find? Sorry to interrupt.
So findings we would do. So we used Engage, compare as is and to be, and it gives you a comparison report essentially, so you can see the time difference, the cost difference, the number of tasks you've usually reduced or maybe increased in 2B. So we built that stuff into what we called a service review report, but was sort of a very, very high level outline business case really. So we're not necessarily prescribing solutions, but we're just saying, you know, if you were to go with this version of the 2B, for example, these could be the potential benefits. So, you know, reduced cost of the process, faster process, and then sometimes there were other benefits as well. So specifically with the foster care stuff, one thing that was increasing the sort of volume of payments going through that process was mileage claims. So we put a few suggestions forward. You know, one was, for example, just a blanket mileage allowance to all foster carers. Maybe adjusted depending on, you know, how far away they live, but rather than having to put every single claim in, just something that can be done at a relatively high level as a sort of blanket payments. That was one of the suggestions. And yeah, just in terms of our process then, so that went to a service review sort of steering group that would include the service. So I believe it's the sort of business support manager for social care at the time, along with our head of finance and head of performance at the time as well. And it was a case of that sort of providing a bit of challenge to the current process and to the recommendations we'd suggested. And then the service area, social care, would take ownership of that report that we'd done essentially. And from there, they would develop their own action plan about how to address it.
Brilliant. Are you able to share that? Now, don't share too much here, but are you able to share what kind of order of magnitude were you finding in some of those processes? I know they'll vary, and you did quite a few, but you know
they will vary. Let's have a look because I've got some notes here.
I'm always intrigued with the actual numbers, but those processes can be, you know, payments in particular can be a clunky process anyway. In social care, it's even harder because, you know, there's a lot more going on around the case as well, you know. So obviously, just to explain, we're not sharing any of these maps. It's not appropriate to share some of them.
The overall potential savings from this piece of work was 100k plus. So I won't give the specifics.
Okay.
From which then
a reasonable amount that you were able to quantify and evidence why and where and how. Yeah, that's pretty amazing, mate. That's a really good piece of work. Considering you were doing it in the trial period and you were brand new with the software as well, that's even more of a
Yeah,
kudos to
yeah,
you.
Engage helped a lot. I think it's not dissimilar to things we would have done in the past, but then it would have been a process in Visio with tons of annotation, and then probably an Excel sheet behind it to calculate everything. And
Yeah,
whenever you change the process, you then got to update the Excel as well. Having it all in one place was a big benefit, I think. Yeah, I think this was one of the challenges there in realizing it is that some of the processes are quite low volume. So you might have maybe a staff time saving as a result, which only equates to about half a post,
yeah,
which makes it difficult to realise. So the service could have decided to accept that as essentially a process efficiency, and they could say, okay, well, if we know this process is now going to be simpler in the future, we can give that post additional work, or we can get them to do something else instead, rather
yeah.
than taking it as a straight saving, if that makes sense.
Yeah, but I mean, a lot of the time we're trying to create efficiency gains because we're trying to free up capacity. Because
Exactly.
obviously, let's be honest, every single council across the last 10 years has lost a significant amount of budget year on year. So a lot of the time, some of our customers are using the stuff that they find to really help a service get their head back above water. But what you've basically described there of being able to improve time cost, improve quality, and basically reduce risk of inappropriate payments, that and achieve savings at the same time, that's really impressive. So I suppose, I mean, that's been brilliant. I think that's fantastic, and I really appreciate you taking the time to share the story because it can only help others to do the same. So yeah, massive thanks to you. And what I'd say is have a lovely weekend, Jacob.
Yeah, you too, Andy.